And welcome to your audio recorded lecture on care of clients living with cancer. This is chapter 18 in your Med-Surg textbook. So the definition and incidence. Cancer consists of a group of more than 200 diseases characterized by uncontrolled and unregulated growth of cells. An estimated 202,400 new cases of cancer and 78,800 deaths from cancer have occurred in Canada in 2016. More than half of all new cases will be prostate, breast, lung, and colorectal cancers. About 2 in 5 Canadians will develop cancer in their lifetime, and 1 of 4 will die of the disease. As the population ages, there is an increase in our cancer rates. It is more common in males versus females, ages 20 to 59. Cancer is the leading cause of death in Canada. Prior was heart. Smoking cigarettes significantly increases the risk of developing cancer. The highest number of deaths is from lung cancer overall, and the highest new cases of cancer is from prostate cancer in males. There are several modifiable risk factors, so things we can change to decrease our risk of getting cancer. That would be smoking tobacco, obesity, lack of physical activity, unhealthy eating habits, and sun exposure. We can modify our risks by looking at those items. Some of the non-modifiable risk factors would include genetics. The pathophysiology of cancer. So in cancer, there is a defect in cellular proliferation, which means there's uncontrolled cell growth and division. There's no control or proliferation from cellular degeneration or death, and there's no contact inhibition. And then also, there are defects in cellular differentiation. So cells change from a state of immaturity to a state of maturity. They are well defined. Genetic alterations and mutations can occur, and the cell regains previous undifferentiated function. Once you minus my video and open up the PowerPoint presentation, and if you open it up in slideshow format, you should be able to watch this video right here on the pathophysiology of cancer, which is quite a great video to watch. It's a TED Ed video. Cancer cells have no regard for cellular boundaries and will grow on top or in between normal cells. Cell division in cancer is very much deregulated. There's no regular pattern for it. Mutations of stem cells occurs during proliferation or the growth, and DNA is substituted and rearranged. So you can see here in this picture in the bottom left, normal cell growth, it's very patterned, the cells are side by side, whereas in cancer, it's very dysregulated. They're of different size, they're clumping on top of each other, they have a small cytoplasm with multiple nuclei. When cells mutate, one of 3 things can occur. The first thing is that cell can die. The second thing is the cell can recognize the damage and repair itself. And the third thing is that the mutated cell can survive and pass along its damage to its daughter cells. Mutated cells that survive can have the potential to become malignant or cancerous. Cancer cells can proliferate or grow at a faster rate than normal cells can. Proliferation of cancer cells is indiscriminate and continuous. What does that mean to you? Well, it means that it just happens. It just happens over and over and over, and it doesn't matter what we try to do. Cell division creates 2 or more offspring cells, and as a result, as you can see here, the tumor starts to grow rapidly. Once that tumor grows and evades the basement membrane, cancer detaches from the tumor and can spread to other parts of the body. That's how we get metastases. This is the process of cancer development in more of a visual format. There is a theoretical model for cancer development, And they say that cancer development is in very much an orderly process. There are 3 stages that include initiation, promotion, and progression. In the initiation phase, exposure to a carcinogen leads to mutation in cells' genetic structure. Some of the causes of mutation can include inheritance, an error in DNA replications, various viruses, hormones, radiation, chemicals, hereditary factors, and various unknown factors. In the promotion phase, this being the second phase of cancer development, there is reversible proliferation of the altered cells, so we can change it. It can get better. There is an increase in the population of altered cells, which increases the likelihood of sustained mutagenesis. Activates of promotion are reversible, like smoking, obesity, alcohol, environmental exposures. We can change those things. And then in the latent period of promotion, the initial genetic alteration to the clinical evidence of cancer may range from 1 to 40 years. A 1 centimeter tumor, that's the size that can be felt on palpation, contains approximately 1 billion cancer cells. Then finally we have the third and final stage. This is the stage of progression. It's characterized by the increased growth rate of the tumor, the invasiveness, and the spread. Over time, the tumor size increases and develops its own blood supply. It invades surrounding tissues and areas of least resistance. Once pieces of the tumor break off, like the cells, into the bloodstream through the basement membrane, they can spread to distant organs. Overall, cancer cells require an adequate blood supply to live, and cells that grow fast need oxygen and nutrients. Tumor angiogenesis is the formation of blood vessels within a tumor. As the tumor increases in size, development of its own blood supply is critical to its survival and growth. This slide here has 2 videos on what is cancer, the anatomy and pathophysiology of it. Again, if you minus this presentation and open this up in slideshow format, you should be able to view each video. There are multiple videos like this throughout the presentation. This is just a picture of cancer metastases and how it happens through the phases 1, 2, 3, 4, 5, 6, 7, 8. This is just a short video on metastases that you can watch. There are 5 common sites of metastases that you will have to know for testing purposes. They are brain, lung, liver, adrenals, and bone. Sometimes people like to remember this in an acronym, so try to make yourself one. A schematic of the metastases process, beginning with an in situ cancer surrounded by an intact basement membrane. Then, invasion requires reversible changes in cell-to-cell and cell-to-extracellular matrix adherence, destruction of proteins in the matrix and stroma, and motility. Metastasizing cells can then enter the lymphatics or directly enter the circulation. Then, survival and arrest of tumor cells, and extravasation of the circulatory system follows. Then, metastatic colonization of the distant site progresses through single cells, which might remain dormant for many, many years, and finally they start to progressively grow into metastases. And there's a picture above as well. Our immune system tries to respond. It acts to reject and destroy these cancer cells that are abnormal looking, clumping on top of each other, and forming a tumor. Tumor-associated antigens attach to the cell wall. Cytotoxic T cells fight the TAAs, along with natural killer cells, macrophages, and B lymphocytes. Sometimes blocking antibodies prevent T cells from interacting with the TAAs. And this is just a picture of that process. When we look at cancer, we look at benign cancer cells, malignant cancer cells. Really, if they're cancer cells, they're often malignant or cancerous. So benign tumors are very much localized. They have limited potential for growth and metastases to other areas in the body. Their cells are well differentiated and they are normally encapsulated. Malignant cells, which are cancerous, they grow and invade and metastasize into other areas of the body. They are very much irregular in shape, as you saw in a previous slide. They are poorly differentiated, and recurrence of the disease is definitely possible. Page 350, Table 18.1 of your medical surgical textbook compares benign and malignant neoplasms. We classify cancer in various ways. Anatomical site classification is identified by the tissue of origin, the anatomical site, and the behavior of the tumor. And by behavior, I mean, is it benign or malignant? And then anatomical site classification. Does it originate from the skin and glands and mucous membrane, the linings of the respiratory tract, GI or GU tract? Originate from connective tissue, muscle, bone, fat, or originated from the hemopoietic system? Appearance of cells and degree of differentiation are evaluated for grade 1, 2, 3, and 4. I will not test this specifically. However, the 0 to 4 disease classification is the extent of the actual disease, and clinical staging via this classification system is quite important. 0 is cancer in situ. 1 is the tumor itself is limited to the tissue of origin, so specifically where it's growing. 3 is extensive local and regional spread to the area, and 4 is metastases to other areas. The TNM classification is also something important to remember for test-taking purposes. TNM stands for tumor size. The N stands for nodes, or spread to lymph nodes, and the M stands for metastases. The TNM classification is noted here. Again, I'm not going to make you remember the specifics of each TNM, but you do need to know what it stands for. This is a cancer film clip. I would suggest reviewing this independently for studying purposes to help better understand the material. There are 7 warning signs of cancer, and they are often expressed in the mnemonic CAUTION. Change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge of any orifice, thickening or a lump in the breast or elsewhere, indigestion or difficulty in swallowing, obvious change in a wart or mole, or nagging cough or hoarseness. You may see 1 to 2 test questions on the detection of cancer 7 warning signs CAUTION. Prevention and detection is extremely important. Reducing or avoiding exposures to known or suspected carcinogens like smoking, sun, and alcohol can assist in the prevention of the disease. Eating a balanced diet, low-fat, high fruit and vegetables, and exercising regularly to maintain a healthy weight, along with adequate healthy rest, is important in prevention of the disease. And then for the detection piece, it's really important that we educate our clients about regular health examinations, especially if they're over the age of 50. We want to eliminate, reduce, or change perceptions of stressors and enhance the ability for individuals to cope. Enjoying consistent periods of relaxation and leisure in school is next to impossible, but once you get out there working as a nurse, it's really important to consider this. Know your 7 warning signs of cancer, CAUTION, so that you can get detection early. Self-examination, know your body well, whether you are male versus female. And seek medical care early if cancer is suspected. And oftentimes, people don't seek medical care early enough because they're in denial or they just don't want to know. The diagnosis can vary and depends on the physician and the type of cancer that is suspected. Biopsy is the definitive procedure for diagnosis. Hint, hint. Surgical acquisition of a piece of tissue from the area is taken. It's examined by a pathologist to determine whether the cancer is benign versus malignant, and also to determine the degree of cellular differentiation. There are 3 types of biopsies that you can read about: needle biopsy, incisional biopsy, and excisional biopsy. But just remembering that biopsy on a whole is the definitive procedure for diagnosing the disease. Clients may experience fear and anxiety. It's therefore important we use clear, consistent, and repeated explanations. The diagnostic plan includes a health history and physical exam of our bodily systems and specific studies including cytology, blood studies, scope scans, and radiology. Ideally, what you can do is look in your course pack and complete an independent study on Brenda Lee's story. The overall goals for cancer include cure, control, and palliation. Curative therapy may involve surgery alone or extended periods of systemic therapy such as chemo and radiation. Control, the treatment plan has an initial course and then a maintenance therapy for controlling the disease. And palliation, the goal of palliative care is to relieve or control symptoms and maintain a patient's quality of life. The treatment modalities. Factors that determine the treatment modality or how the patient is specifically going to be treated for that type of cancer is the types of cells within the tumor, the location and size of it, and the extent of the disease. Nurses must know the goals of the treatment in order to communicate it to the patient and to support the patient. Treatment modalities can be used alone or in combination, so one thing can be used or multiple things can be used. Surgery, chemo, radiation, and biological therapies are often options. Surgical therapy is used to control or cure a disease, the disease process. It involves removal of the tumor and the margins of the surrounding tissue. It's more successful if the cancer is growing at a slower rate, and may work for more local cancers, but is often quite ineffective if the cancer has spread to other areas of the body. The role of surgery in cancer treatment includes diagnosis, especially if they need to take a biopsy, palliation of symptoms, rehab, determining the diagnostic and treatment plan, to cure or control the cancer, and to provide supportive care. Chemotherapy is another option. This is through the use of chemicals as a systemic therapy for cancer. It's used for curing it, controlling it, and palliative. It affects cell replication and proliferation. There are 2 main categories of chemotherapeutic drugs. One is the cell cycle phase, and one is the cell cycle phase. One is cell cycle phase non-specific, and one is cell cycle phase specific. For testing purposes, you don't need to know the different types of chemotherapy agents. You just need to know how it works for that patient and what your care is going to include for a patient who is on chemotherapy. The goal overall of chemo is to reduce the number of cancer cells in the tumor site. There are many types of agents. There are many ways to administer chemotherapy. The problem with chemotherapy agents is that they cannot distinguish between normal and cancer cells, so they often attack both. Factors that determine the response of cancer cells to chemotherapy include the mitotic rate of the tissue from which the tumor arises, the size of the tumor, the age of the tumor, the location of it, and the presence of resistant tumor cells. Chemotherapy drugs are categorized based on their structure and mechanism of action, and again, we won't get into huge detail about chemo. The reason for this is after you graduate, if cancer care interests you, there are actually separate courses that you can take to be certified to assist with this. Like I mentioned, chemotherapy does not only affect the cancer cells, but it also goes after normal cells. So the side effects that can happen because normal cells are destructed include acute toxicity, vomiting, allergic reaction, and arrhythmias. Some of the delayed effects of chemotherapy from the destruction of normal cells include mouth sores, gastritis, loose stool, alopecia, and bone marrow suppression. And again, that's why I say it's important to look at the signs and symptoms your client's experiencing if they're undergoing chemo and trying to assist them in feeling better from those. One of the other things is radiation therapy. It's a more localized treatment. The emission and distribution of energy through space or material medium. Energy produced by radiation when absorbed into the tissue produces ionization and excitation. Generation of free radicals breaks up chemical bonds in DNA and may produce lethal or sublethal damage. The break in the bonds in DNA causes a loss of proliferative capacity of the tumor. Normal tissues are usually able to recover from radiation-type therapy. And biological therapy. This treatment uses biological agents which encourage a person's antibodies and hormones to modify the relationship between the host and the tumor. For example, prostate cancer treatments often include biological therapy. Bone marrow and stem cell transplant. So bone marrow, this transplantation allows for safe use of very high doses of chemo and radiation. So often patients who need chemo and radiation might also get a bone marrow transplant just so that they can use very high doses. And gene therapy involves the transfer of genes into the cells of clients in an effort to correct the defective gene. And there's just a picture there about bone marrow transplants. Nursing considerations include educating clients about treatment and side effects, as I previously mentioned. Administration of antiemetic drugs is also really important. So if a client is going for chemo or radiation and they often are experiencing nausea for whatever reason during the treatment, then it wouldn't be best to administer that antiemetic drug when they experience nausea, because we know they're going to experience it because they've told us. So it's best to administer the drug prior to the treatment so that it assists with the nausea during. Monitoring lab results, assessing for signs and symptoms of bleeding, and assessing for febrile neutropenia is very important. So we often tell patients who are undergoing chemotherapy, if they have a fever of a certain temperature, they need to seek emergency room care. Independent learning activities. So what I want you to do is go through your textbook for Med-Surg and think, why is the patient experiencing these specific symptoms and what are you going to do about it? Because those are the types of test questions you're going to see. The emphasis is on maintaining an optimal quality of life overall. We talked a lot about the maintenance of hope and how important that is for the client and their family. Positive attitudes of the client, family, and healthcare providers have a significant impact on the quality of life for the client and also influence the prognosis. Evidence supports the effectiveness of services aimed at relieving the emotional distress that accompanies many chronic illnesses, including cancer, even in the case of debilitating depression and anxiety. So just remember that. Maintain hope. Moderate to severe pain occurs in half of all patients receiving active treatment for cancer and occurs in 80% of those who have advanced cancer. Undertreatment is common and has serious outcomes on the quality of life, the ability to function, and family and caregiver burden. So it is important that we trust the client when they state that they are in pain and that we treat their pain. If their pain is not adequately being treated, we need to talk to the physician. Medications such as non-steroidal anti-inflammatories and opioids are often common. Regular scheduled medications with additional doses for breakthrough pain is very much appropriate. Appropriate dose controls the pain with minimal side effects. Patient-controlled analgesia, also known as PCA, is often a preferred method so that the patient can dose themselves. Again, we really need to watch for side effects, as other medications may be required to reduce the side effects of taking these types of medications. Tolerance and physical dependence should not be confused with psychological dependence or physiological dependence and addiction. So basically what this is saying is that we should not confuse tolerance and physical dependence on the drug with psychological dependence and addiction. So often cancer patients will require more pain medications as time goes on, or a higher dose of these pain medications. This does not mean that they are addicted to it or psychologically dependent on it. What it means is that they've become tolerant of this medication and that dose, and therefore over time they need a bit more of it. And this is a normal process. So just a few questions for your review here. Which of the following statements about chemotherapy is true? Is the answer A, B, C, or D? I'll let you pause this video and then you can hit play when you're ready for the answer. The answer is D. Mrs. Smith reports nausea and vomiting following her daily chemotherapy treatment. Which of the following is the most appropriate nursing intervention? This is something that I did mention a couple slides prior. Again, please pause this video and press play for the answer. The answer is B. A client with cancer is taking an opioid for chronic unrelieved pain. Which of the following will likely happen over time? Again, please pause this video and press play for the answer. The answer here is D. That's the end of your presentation on cancer care. Remember, cancer care is included on midterm B, so review these slides and read the chapters on cancer in your textbook to assist with your understanding. A couple of little hints for the test is no cancer classifications like the TNM scale, etc. Thank you and have a good day.